Welcome to this short tutorial on how to approach Assessment 3, your final assignment for cultural safety in health. This assignment is due Monday of week 13, should be between 1,000 to 1,500 words, excluding references, and contributes 40% to your overall mark for cultural safety in health. One of the strategies that you can adopt when approaching an assignment, especially a written task like this, is to make sure that you're aware of what the purpose of the assignment is. And that allows you to give some context to your assignment. So you don't sit there thinking, oh, what's this got to do with my future career, etc. What's the relevance? So the purpose of this assignment is to assist you to develop an understanding of the importance of cultural safety in your own workplace and allow you to demonstrate your understanding of the knowledge on the principles of cultural safety and how they contribute to health outcomes. So that's great if you're actually working in an organisation, a health organisation. You can base it on that organisation. If you're not working in a health organisation, you can choose one that you have worked for, that you really admire, that you're interested in, that happens to be across the road from you, that your sister works for, etc. I'll leave that up to you to choose. So it's any organisation of your liking. And what you want to do, the purpose of doing a position statement is that it allows you to demonstrate to the assessor that you understand why cultural safety is important and why it is important that organisations behave in a culturally safe manner. And that is, that organisations make how they interact with their clients or their target audience a priority. So the first thing that you'll need to do is find an organisation. Like I said previously, it can be one that you have worked with, you are interested in working with, one that you've done your placement at, etc. I don't mind. The whole point is that for you to find that organisation or select that organisation, do a little bit of research about it, what type of organisation it is, who it targets, is it based in the rural sector, remote sector? Does it have a diverse target group, or does it purely focus, say, young people or Aboriginal and Torres Strait Islanders, etc.? And you might even dig a little deeper and find out what sort of reputation that organisation has had. Has it ever had any sort of scandal, or has it ever been in the media for any events that might be good or bad? Now, if you're not sure what a position statement is, this is the best definition that I've been able to locate, and this is the definition I want you to work by. It's a range of evidence-based statements to communicate an organisation's position on key issues relevant to achieving a healthy Australia, supported by the best possible healthcare system. So a position statement is basically how an organisation will promote how it's going to communicate and interact with its target audience. In the second part of the assignment, you will need to address why an organisation needs a position statement. What's the purpose of doing it? So what is an organisation addressing when they do have a position statement? Now remember, you need to look at some of the reasons. Chiefly, does a position statement support redressing power imbalances? Does it address historical or even contemporary institutional discrimination and health equities? Does it undo the injustices of the past? For example, if you look at a lot of the position statements that are currently available, especially in the Aboriginal and Torres Strait Islander organisations, there is mention that the organisation strives to address systemic racism, recognises historical policies regarding the stolen generation, or relocating people off country, the role that that plays in some of the power and health issues that are currently prevalent in the Indigenous community. You also might have a position statement will recognise the role of, people that have had to flee areas like refugee or asylum seeker populations, people that have been discriminated against historically for past federal or state legislation. So those are all the things that can be contained in a position statement, because what you're trying to do is say, as an organisation, we are going to work to redress any issues that contribute to a poor cultural safety at a systemic level. Going back to your assignment, in the second section you'll need to discuss the importance of effective communication and the role that between health literacy and effective communication. Now remember, you haven't got a lot of words. You've got a maximum of 1,500 words, somewhere between 1,000 usually for the part 2. So you don't need to put a lot of information, but you do need to acknowledge the relationship and maybe bring in some of the references which link all of the concepts together. Okay, now in part 2 you'll also need to discuss and provide some analysis on the influence of some external factors on an organisation, or the influence that historical factors have had on the people who use the organisation or the target audience, particularly around organisations that say work with marginalised population groups or groups that have previously sort of been on the outer, for want of a better term, and how might an organisation address those factors in its position statement. You might see this in organisations that have previously worked with or have worked with the LGBTQI community. Like they might mention that they acknowledge that historically their target group has not always been fairly treated. Or you might even see this in organisations that have previously had a religious connection, especially regarding some of the scandal that's happened amongst some of the religious organisations. So you don't need to provide an in-depth discussion, but you just need to make reference to it and acknowledge that might actually, that a position statement might help redress those issues. And finally, what you'll need to do is discuss what are the barriers that may exist towards implementing this position statement, and how might these barriers might be overdressed. Now you might use, for example, there's been a lot of conversation about the use of interpreters within healthcare services, and so an organisation may have that they're going to use interpreters or to use appropriately trained staff when communicating with their clients in their position statement. But some of the barriers to that might be the lack of availability of actually interpreters or interpreting services in that area. So you could here discuss about how an organisation might be able to implement strategies to overcome that. And finally, just some general feedback. Please don't use abbreviations unless they are recognised or commonly accepted abbreviations. Please proofread your work. Follow the assessment instructions. I don't mind if you use subheadings. If you find that easier to put an argument or your paper together, that's fine. And just remember, this is a little quote from Nicola Rolls' book on communicating in universities, that presenting a poorly edited assignment with proofreading errors and spelling mistakes and etc. is like giving a present wrapped in dirty paper. So you can do a really well researched, beautifully put together assignment, but if it's got spelling errors and punctuation errors all through it, it really detracts from the overall impression that you give the markers. So whilst markers try not to take that too much on board. If it's hard to read, if the assignment is hard for someone to read so they can mark it, they're naturally going to mark it down a bit. So just remember that. The way to get around that is to give yourself enough time to proofread it so you're not submitting it in a rush or putting it together in a rush. Good luck.